Thank you so much, Dr. Arti Sarwal, for joining us regarding a very not just medically but socially important topic of stroke.
Thank you for having me.
Thank you. So, just to begin our conversation about it, how does somebody know that they are having a stroke?
There's a mnemonic that we propagate for public education. It's called FAST. If you think you're having any symptoms involving the face, the arms, or symptoms involving your speech, you should think of symptoms of stroke and call 911. So FAST, F for face,
F for face,
A for arms,
A for arms,
S for speech.
S for speech.
So any of these three have abnormalities. The face droops on one side, the arms stopped working on one side, or you have abnormalities of speech, you should not lose time and call 911.
Yeah. So arm weakness or also leg weakness, any weakness of any extremities. So FAST is a very good way to remember the neurological deficits. I had a patient once who came to me after several days of sustaining stroke, and he thought that it's just going to go away. He didn't realize it's an emergency. And he was actually pretty well read, so that's why I was so surprised. And he said, anyways, doctor can't do anything about it. Once I sustain a stroke, nothing can be done. So I didn't really think I need to come and see the doctor. So just for our viewers, affirmation to validate this point, is it a medical emergency?
Stroke is a medical emergency, and unfortunately the biggest reason why people don't seek urgent attention for stroke is lack of public education, that there are many stroke therapies available which can help you recover from even devastating strokes if you get medical help in time. If you present within 3 hours of the onset of a witnessed stroke,
within 3 hours,
we can give you a medicine called TPA that can help reverse the deficits of a stroke. Even if you can't make it in 3 hours, if you meet certain criteria and have certain kinds of stroke, we can even give you acute therapies as long as 4.5 hours. And in very restricted cases, some interventions can be done even as late as 12 to 24 hours. But again, it depends on the kind of stroke. But I would urge that if you are witnessing another person by your side who has any symptoms that are suspicious of stroke based on a new face droop, new speech abnormality, new arm or leg weakness, please call 911 without any delay.
So it's a time-sensitive medical condition.
So
that's why it is very important to recognize that it's a medical emergency, and there are actually interventions we can use to treat it and address the condition of stroke. So don't defer the treatment. Act fast.
Yes.
And recognize fast.
Yes.
And once a person has sustained stroke, the question is always, how fast am I going to recover? How long will I stay in the hospital? These are pretty disabling symptoms, and duration and time of recovery is their very immediate questions once the unfortunate somebody has sustained stroke. What would you want to tell our viewers about that?
So it's very variable. To answer your question, it depends on what kind of stroke you have, how eligible you were for some acute therapies, how you respond to those therapies, and what kind of care do you get after a stroke. There are certain kind of strokes where, despite presenting late, and only secondary stroke prevention can get you back to normal life as it was before the stroke. But there are strokes that, if they do not get any acute intervention and acute therapy, can disable you to the point that you may not be able to take care of yourself. The cornerstone of recovery in stroke is getting therapy emergently.
Okay, so emergent physical therapy.
Not just physical therapy,
medical therapy.
Emergent medical therapy.
Right.
So when you have a stroke, even if the symptoms are extremely disabling, or if the symptoms are not disabling but are getting better as you are thinking about having a stroke, you should still seek medical attention, because your recovery down the line all depends on how emergently we gave you therapy for that stroke and what kind of stroke care did you get in the recovery period.
Okay.
Even devastating strokes, if they come into medical attention at the right time, get the right kind of medical attention, respond to it, get good stroke care including physical therapy, swallow evaluation, good nursing care, occupational therapy. It may take you time, but it is very possible that you can return back to what you were doing prior to the stroke. But again, it all depends on how quickly you get medical intervention, what kind of stroke care you get in the recovery period. And it's very difficult for us to give a black and white answer to that question the moment you come in. It all depends on the hours or a couple of days that elapse after the stroke happens. But just the fear that I have a devastating stroke, I would not advise anybody to not seek medical attention just based on the fear that you will not recover.
Right. So timely intervention, timely reporting to the emergency ER, calling 911, getting the right medical treatment promptly, and thereafter physical therapy. These will be the cornerstone for
you can recover from even very devastating strokes.
Yeah. So for our viewers, how do they recognize they're at risk of stroke?
There are many lifestyle choices, as well as your family history, that can help you understand your risk of stroke.
Okay.
There are certain kinds of stroke that run in families. If your family has a long history of early heart attacks, early history of stroke, or a younger age of having a stroke or a heart attack.
In the family?
Especially first degree family relatives.
First degree. And what is first degree family relative?
Your brother, your sister,
siblings,
your immediate parents, your children.
Got it.
Then you are probably at an increased risk of stroke and should get your risk factors addressed with your primary care provider. Certain lifestyle choices can also affect your risk of stroke. Things like smoking, alcohol, poor diet, not having a good exercise as a part of your regular lifestyle, sedentary lifestyle, obesity. These are things that are modifiable things about your day-to-day living that increase your risk of having a stroke. There are certain medical conditions that increase your risk of stroke, like high blood pressure, high cholesterol, or having a higher tendency to form clots. But these are things that you can have your primary care provider evaluate and give you treatment to address these. And if you take adequate medical therapy for either of these conditions, you can decrease your chances of having a stroke even if you had these conditions initially.
Yeah, so basically there are certain factors that put you at risk of stroke that you can't modify. For example, the family history and their genetic risk factor that that put you at risk of stroke. You cannot modify them. But lifestyle modifications like obesity or tobacco use or drug use like cocaine or other recreational drugs, that you can modify. And the third will be the comorbid conditions, hypertension, chronic kidney disease, diabetes, clotting disorder, high cholesterol. So those, or atrial fibrillation, and managing those medical conditions can decrease your stroke risk.
Yes. But the key is to get medical attention for that and follow the medical advice given by your providers.
By your providers. And once a person has sustained stroke, how much is it likely that they'll get another stroke?
Again, it depends on your risk factors. When you get medical attention adequately for the acute stroke that you have, after the providers have given you the acute therapy, their primary focus shifts to secondary stroke prevention. What that means is, prior to you being discharged from the care of a clinical provider, they will make sure that your risk factors have been addressed that portend increased risk of having a stroke in the future, and give you adequate medical therapy for making that not happen in the future. What that means is, if your blood has a higher chance of clotting, they might give you an antiplatelet agent called aspirin or Plavix, or a combination of the two, or some other agents that will help thin your blood. If you have strokes that are caused by abnormal rhythms in the heart, they might decide to give you a very strong blood thinner called Coumadin, and some other agents that also thin blood just like Coumadin. They will address your high cholesterol and may give you drugs like statins to help lower your cholesterol. Overall, like I said, once you sought medical attention for acute stroke, prior to discharge from that facility for that stroke, your provider should give you a definite plan of your future risk of stroke and give you interventions that you can do on a daily basis to keep you from having a stroke in the future. If your lifestyle choices were not optimal in the past, they may advise you to eat healthier, have an exercise as a part of your daily routine, eat a low cholesterol, low sodium diet. If your blood pressure, diabetes, and other medical problems were not under very good control prior, they may give you an alternate plan that will help you get these under better control. So there are lots of things that we can do to predict your risk of having a stroke in the future, but more so, there are many things that we can advise you to do that can keep your risk of having that stroke in the future as minimal as possible.
Okay. I'm going to give my cell phone to Steph. We will delete this segment.
Okay.